have you do is lock and unlock the brake with your right hand and get a feel for it. And now what you're doing there, bring your hand back. Now you're going to do that with your left hand. Lean into it and push. Did you know you could do that? Lean into it, not yet, and push. Good. Now I know your trunk and your shoulder are doing most of that, but getting this hand to kind of push is a good start. The next thing I'm going to have you do is try to hold a cup and take a sip from the cup. And the way we're going to do that is we're going to have both hands work together. And the cup is just the right size to get the hand to be in a nice, comfortable, natural position. We're going to have the right hand here. I'm going to help you the first time. And you don't have to actually take a sip, but we're just getting the motion down. Up and back. Very nice. Now I know the right hand's doing most of the work, but the left hand is relearning that it can be involved in this activity. So that's good. So your goal is, let's say during a meal, is to say, well, let me see if I can do this, put this in this hand, and get my left hand involved in it, maybe just for 2 sips out of a meal. Similarly, you're just starting to get a little bit of finger motion like this. I'm going to bring your hand this way, fingers that way, hold it, very nice. Hold it just like that. Now, what I'm going to have you try to do is bring your hand over, relax your wrist and fingers, and drop it. So what you're working on is getting that hand to hold and release. Up, down, hold it, good try. One more time. Down and release. Very good. So when your palm comes down, your wrist and fingers open up just like that. You can see there's that separation. Whereas when you roll it this way, you can see it closes. It's just a natural, and we're taking advantage of that. So another thing you can try, hold your left wrist with your right wrist and bring it up towards your mouth. You don't have to take a bite. And down and back and forth. Now I know naturally you would use your right hand to feed yourself, but again, we're looking for any excuse, any opportunity to get the left hand involved in an activity. Another one we might try is, let's say you were opening this. Now you could, with your right hand, just twist the top off like that. But again, that sends the signal to the left arm that there's no job for it to do, so there's no use in getting, there's no sense in getting stronger. So what I'm going to have you do is hold it just like that, and let's say you're doing your morning routine and you're at the sink and you're going to put some lotion on. You could put it right into your hand like that, and with your right hand take the top off. Good. And back on again. Very good. Now, just to show off, I'm going to have you try to squeeze that with your hand. Very good. So this is coming back. Like a lot of folks, they get stronger in their chest muscles, their biceps, and the muscles right in here that squeeze. And you can see you're starting to get that. The muscles that tend to be slower are the muscles that open up. And the trick for that is, I'm going to have you put your hand just like this, and you're going to catch it when it falls. And good try. We're going to do that one more time. And open. Very good. Now you saw a little bit just then, your fingers do that, and that's what we're looking for. And sometimes the trick I use for that to get that even stronger is to reach down, and spread open your hand. There. Perfect. That's the first time we've seen that. Go ahead and sit up again. So that whole stretching down and reaching kind of comes as a whole kind of pattern. The other thing that you can do during daily activities is, let's say you're doing your shower and you're going to be washing your leg. You could include this hand by putting this hand over here, and you're just going to rub here, just like that. You're going to wash your shin, so reach down and rub down there. Very nice. Good. So right now, the left arm's getting into the activity. It's getting lots of nice stimulation. Let's try one more thing. this, let's put this hand here. This hand is going to rub this arm just like that. Let me have you return the favor first. So rub this arm just like that. So a lot of times I'll have your right hand do things first, get a feel for it and what we're doing, and then try the left hand. Hold here, down and up, down and up. Now hold it right there. Use this big muscle there and hold it, hold it, hold it, and down. Good. Pull it up. Good, and down. Now what you might notice is when you pulled it up, this shoulder tended to come up like that. And when we're trying to get this arm to be more functional, we'll be watching that everything is done with good quality. I wouldn't want you to try to do a lot of things where your arm kind of went into an awkward posture. So I don't want to have any bad habits develop so you don't have to get rid of them later. So that's great. That was good. The next thing I'm going to have you do is show you some things that you can do in standing. Okay, now what we're going to do next is something at the table. I'm going to bring it in close to you. What I'm going to have you do is lean forward and stand up tall. Good. You feel all right? Mm-hmm. Good. I'm going to bring the table in, and I'm going to help this arm come up. Very nice. Now, we did several things sitting, but I want at home for you to do lots of things in standing too. That'll help your leg strength and get you ready for walking. One of the things you might try is having the hand just like this. This is very nice position for your wrist. And with this hand, I just want you to wipe the countertop like you've just prepared something for lunch and you're wiping the countertop. Very nice. Now next, you're going to try the same thing with both hands together. Very nice. Now if need be, this hand could sit kind of partially on top, and you're going to do kind of a circular motion. Very nice. So again, this gets your arm moving in a functional activity. Very nice. Good. Now take this hand away, and your shoulder looks great. You're not kind of leaning into it too heavily. I'm going to have you move your hand from here to there. And you can go ahead and rotate your shoulders as you do that. Look towards me and reach out. Perfect. That's very nice. And pull in. Very good. Reach out. Pull in. Rotate. Throw your shoulder into it. Very nice. Good. This time you're going to go for a spot right over there and reach way out. Reach. Perfect. Come all the way back. So you can see your trunk and your shoulder go with that too. Very nice. Now the thing I know with physical therapy, you're getting to do some walking. In the future, what I'm hoping for is, let's say it's a month from now and you're going to the grocery store, is that you could hold the grocery cart with two hands and push it just like that. So that's what I'm kind of getting you ready for, is that pushing motion. Again, you could try to do things one-handed, but we want to include the left hand in any opportunity during the day that we can. Sounds good?
Good.